afternoon, everyone. Today, I'd like to update you on Alberta's vaccine program and the amazing progress that's been made. A week ago, I said that vaccines were our ticket out of the pandemic. Vaccines work. They save lives and they stop the spread. And we need to immunize people as quickly as we can so that we can get back to normal. To help stop the spike, we needed to rapidly expand our vaccine rollout. Since then, I'm proud to say that we've kicked it into high gear. On Thursday, we took the bold step of opening eligibility to anyone aged 30 and older. We were the first province in Canada to take this leap, and we did it because this meant vaccines would be getting into arms quicker. Our incoming vaccine supply, which earlier this year was delayed and unpredictable, has finally stabilized, and the results have been remarkable. On the first day that we expanded to the whole population on May the 6th, we set a new record with nearly 60,000 doses in one day alone, a record high. And since then, we have, in fact, on the next Friday, we did more than 53,000 jabs. Altogether last week, we delivered over 270,000 doses of the vaccine, and that is incredible. A while back, I said that Generation X, had stepped up to the plate and booked appointments as quick as they could. Well, there's no doubt that millennials and Generation Z have also risen to the challenge in the last week or so. Yesterday, we took our vaccine program even further, opening bookings up to every Albertan age 12 and older. In one day alone, we booked more than 190,000 appointments through AHS, and pharmacies combined. There are now over 328,000 people already signed up and booked to get their shot over the next week. That's almost 10% of the entire eligible population in 1 week alone. We're booking appointments as fast as the incoming supply of vaccines allows. And that is why, by tomorrow, we fully expect to administer our 2 millionth dose in Alberta. To put it in perspective, it took Alberta 119 days to reach our first 1 million doses administered. And if we stay on target for tomorrow, it will have taken only 29 days to reach the 2nd million. This is a big milestone for our province, and I want to thank every Albertan who's done their part. I know there were many who waited patiently online and who have called one pharmacy after another trying to find an open spot. Many people got up early and stayed up late to get in line on the AHS booking system. We appreciate everyone being eager and showing patience. It should be a source of hope and confidence that millions of Albertans have now felt the relief of knowing that they are developing protection against this lethal virus. And I'm sure that thousands of parents and guardians across the province felt a burden lifted from their shoulders as they booked their kids' appointments. I've seen many parents say how it was even more emotional to book those appointments for their kids than when they book appointments for themselves. All of these moments give us a brief glimpse towards the exit and the end of this pandemic and a return to normal life. Alberta is the only province in Canada offering the vaccine to anyone 12 years of age and older right now. In fact, we are leaps and bounds ahead of other provinces in terms of the breadth of our rollout when it comes to rolling out the vaccine to the general population. In other provinces, you have to be older than 30 or in some cases 40 to get vaccinated. But we've kept it simple in Alberta, focusing at first on the elderly and others more likely to get sick from COVID, which is why we've been able now to open it up to the general population. Since day one of Alberta's vaccine rollout, we've held firm to a single guiding principle: to protect the vulnerable first. A total of 3.8 million Albertans are now eligible, and we will do whatever it takes to get doses into their arms. The results we have achieved through this approach are promising. By starting our vaccine program with our elderly who were most at risk, we've seen a dramatic decrease in the most severe COVID-19 outcomes, that is to say, the ratio of cases to hospitalizations and, most importantly, the loss of life. During Wave 2, those 65 and older made up more than 60% of hospitalizations, This has decreased about 36% of hospitalizations in April and May. And currently, only about 2 out of 10 Albertans hospitalized due to COVID-19 are over the age of 75, a drop of 50% from the wave we experienced in November, December. While these are big decreases, we only need to look to our long-term care and supportive living residents to signal how truly effective the vaccines are. During the second wave, about 1 in 4 hospitalizations were long-term care and designated supportive living residents. Now, in the third wave, only 2% are. And we've almost stamped out hospitalizations amongst this especially vulnerable group. It's remarkable to see the effect of the vaccines have on the group that this group in particular seen as many have now received both doses. In fact, we're leading the country in double doses administered at about 8.3%. Tragically, during the second wave, we've had a daily average of 18 COVID-19 related deaths, but since the beginning of April, this has decreased to 3 daily deaths on average. This means our fatality rate has decreased from 2.7% during the second wave to below 1% now. While every single loss is felt throughout the province and grieved over by loved ones and family, it is encouraging that we have been able to offer protection to so many Albertans and to prevent even more severe outcomes because of vaccines. I hope that this information stresses just how important it is for Albertans to continue to make the choice to get vaccinated. As more of us make the choice to be vaccinated, this circle of protection from severe outcomes will continue to grow, capturing younger and younger age groups as well. Today, nearly 45% of Albertans 16 years of age and older are now protected with at least 1 dose of vaccine. This means that about 1 in 3 Albertans have made the choice to get their vaccine, helping us get closer to widespread immunity. While this is tremendous progress, we will not slow down. Based on our current supply, we expect to have 1/2 of the population vaccinated by the first week of June and 2/3 around the 3rd week of June. A total of 3.8 million Albertans, as I mentioned, are now eligible, and we'll do whatever we can to administer those. So in the coming days, we'll be ramping up our advertising campaign to help all Albertans understand that getting vaccinated will help us all get back to normal. Albertans will begin to see ads like this one pop up on billboards in their social media feeds over the next few days. The message is as simple as it is powerful. Your vaccine is your ticket back to normal life. Of course, the first dose is only half the battle. For all vaccines currently available in Alberta, it takes 2 doses for you to be fully protected. We're already working to make it even quicker and easier to roll out millions of second doses this summer. And as I said, we're at a head start compared to other provinces. Work is underway to develop a new one-stop centralized booking system that'll let you book appointments at AHS clinics, pharmacies, or participating physicians' offices. This will help not only roll out the COVID vaccine, but flu shots and other vaccines too. I'll have more information to share on this system when it launches next month. And we are also working with the Department of Education on potentially rolling out school clinics for vaccination for those 12 and older. Meanwhile, I'm asking everyone to book their dose as soon as possible. Take the first appointment you can get and to keep checking with pharmacies or AHS through their website or by calling 811, because more appointments will open up as the supply is confirmed, and we are looking to receive about 1 million doses over the next 3 weeks. If you manage to book an earlier or more convenient appointment, make sure to cancel the first one so someone else can use it. If this urgent sense of us needing to come together to protect not only ourselves, but others and the future of our province isn't truly Albertan, then I don't really know what is. So I know that it may be tempting to ease up on all measures, but I assure those who have had 1 dose of vaccines, all 1.6 million of you, to keep following the public health measures in place. While first doses provide a lot of protection, you don't get the full protective power of the vaccines until 2 weeks after your second dose. And even though you may have 1 dose, your loved ones, a cashier at the grocery store, or a person you that you have some encounter with may not have had their first appointment yet. We all need you to hold on just a little while longer, to follow the current restrictions, to wear a mask, to help us protect everyone until they're vaccinated. I know that most of you are doing the right thing, and to the majority of Albertans, keep it up. We are in the home stretch now. More vaccines are arriving every day, and we're getting closer to widespread immunity. So regardless of who you are or where you live or what your motivation for following measures is, please continue to do your part just as so many other Albertans are. Thank you, and I invite Dr. Hinshaw to provide today's COVID-19 update, and then we'll take questions from the media.
Thank you, Premier, and good afternoon, everyone. Before I get to today's update, I want to provide a note on the change that we are making to how AstraZeneca is used in Alberta. More than 255,000 doses of AstraZeneca vaccine has been administered in the province, which means there are more than 250,000 people with protection from infection and severe outcomes that they would not otherwise have had. However, based on global supply challenges, we do not know when Canada and in turn Alberta will receive additional doses. That is why, effective today, we are holding our remaining AstraZeneca supply for either those who have a contraindication to an mRNA vaccine or for second doses, recognizing that some Albertans will need a second dose beginning in early June. This means that all new first dose appointments, unless there is a contraindication, are being booked with the mRNA vaccines Pfizer and Moderna. We are receiving more than 230,000 doses a week of these vaccines. I know there are some questions about whether Albertans who received a first dose of AstraZeneca vaccine will be able to receive an mRNA vaccine for their second dose. No decisions have been made at this time, but we are reviewing all available evidence and awaiting the results of clinical trials in the UK. I also want to be clear that we are waiting at least 12 weeks before beginning second doses for those who received AstraZeneca vaccine, as clinical trials on this vaccine showed that shorter intervals resulted in less protection than waiting for 12 weeks. As always, we will share any updates as soon as we can. Turning to today's numbers. Over the last 24 hours, we have identified 1,449 new cases of COVID-19 and completed about 11,800 tests. Our positivity rate was about 12.7%. Our growth rate has declined slightly across the province. Alberta's reproductive rate, or R value, for May 3rd to 9th decreased from 1.12 to 1. The Calgary zone dropped from 1.16 to 1.06. Edmonton zone dropped from 0.99 to 0.96. And the biggest drop was seen in the rest of the province as they declined from 1.18 to 0.94. These are positive signs that transmission may be starting to slow, although the Calgary zone is still quite high. Having said that, it is important to note that our active case count is the second highest that it's ever been, and our positivity rate is still very high. There are now 705 people in hospital being treated for COVID-19, including 163 in the ICU. Sadly, I must announce that 3 new deaths were reported to Alberta Health within the last 24 hours. I know there are many in the province experiencing grief, and my sympathies are with the loved ones of all those who passed away from COVID-19 or any other cause. I ask that if you know someone who is grieving today, that you reach out to let them know that you are thinking about them. These difficult days are made harder by current public health measures, and yet we can still help each other through this difficult time. I would like to remind Albertans that all the restrictions that were announced last week are now in effect. In addition to the province-wide measures, there are additional restrictions in place for areas with at least 50 cases per 100,000 people and at least 30 active cases. We have received questions about these regional thresholds, so I'd like to clarify that any area that meets or exceeds these active case rates and active case numbers will automatically have the additional restrictions go into effect. These restrictions remain in place for at least 3 weeks, even if a community moves below the threshold, and will be extended if necessary. I know restrictions are never easy, even after more than a year of living with COVID-19. I also recognize they have many impacts on the lives of Albertans. Unfortunately, they are necessary to get this third wave under control and relieve the building pressure on our healthcare system. They are also key to giving us more time to get more people vaccinated. I want to thank every single Albertan who continues to do their part to help us get through this pandemic. From following public health orders to getting immunized, you are making a difference. Thank you, and we're happy to take questions.
We'll now go to the phones for questions. We'll have 2 questions each today, either 2 off the top or 1 question, 1 follow-up. Operator, can you please put through our first caller?
Heather Urix, Global News.
Hi there. Yes, I had a question about the outbreaks up in the oil sands. With hundreds of active cases still happening up there, and the CNRL Horizon being the largest outbreak by far, it seems that the cases there surged during their the shutdown turnaround period. I'm wondering if the province has provided any guidance to other sites entering these maintenance periods that are seeing additional workers come on site, and why these maintenance periods aren't being deferred until the risk decreases.
Doctor, well, I can tell you that I do know in a couple of instances that maintenance turnaround has been deferred. Mark Little, CEO of Suncor, informed me that they moved their big March turnaround to June in order to mitigate risk, and I think that has happened in some other instances. But, Doctor, would you like to comment on the details of the province's collaboration with those operators on those issues?
Absolutely, and I'm not able to speak about the decisions around timing of the maintenance, but what I can say is that Alberta Health Services has been in constant contact with these companies to make sure that not only are the outbreak restrictions and measures in place, but vaccination is being offered both on site as well as to off-site workers who may be then going on site in the near future. Rapid testing is being made available, and there are, again, many different interventions that are being offered to stop the transmission in these sites. What we are seeing, unfortunately, is the impact of some of the variants of concern. As in many other places in the province, we have seen transmission increase when variants of concern are introduced. We are seeing that impact on these sites as well. And as I said, with vaccination, rapid testing, and outbreak measures, we anticipate that these outbreaks will be under control in the near future.
Operator, can you put through the next caller, please?
Our next question comes from Rick Bell, Calgary Sun.
Good afternoon, Premier and Dr. Hinshaw. I just want to clear something up here, and I have one question and then I'll have a follow-up. Premier, last week you talked about what could happen if there was a sort of arithmetical increase in cases. We could see an overwhelming of the healthcare system, especially in terms of ICU beds, by early June. What I want to ask you today, though, is when you look at the graphs of where we are at, the graphs that are publicly available and whatever graphs you have access to, not arithmetic, not modeling, just what do you see? Because it seems to be recent stories, recent analysis has been quite bleak. So I'm just asking you, what do you see now? Because I think when some people see those, we see something that looks very close to becoming a plateau of ICU beds and non-ICU beds. They are going up, but going up slower. So I would just like to know, what do you see as the situation now in terms of being at a peak perhaps, or being at a plateau? And then I'll have a follow-up.
Sure. So just to give you the straight numbers, Rick, as of last night, we had 163 COVID patients in intensive care. And we watched the intensive care numbers particularly closely because of the scarcity of staffed beds. But that's in addition to about 60 non-COVID patients in intensive care beds. So we have about 220 patients in intensive care across our 100 hospitals. And Rick, the historic high in the 100-plus year history of the province in intensive care was 190 patients before this month. And that was last December. So I think the previous non-COVID historic high for ICU occupancy in Alberta was about 170. And so we are now about 50 beds beyond our historic high ICU capacity. So I just mention that to put that in a bit of context here, because it's not just COVID. People are still getting into car accidents, having heart attacks, needing that intensive care. And I know that it can look like the numbers have plateaued, but Rick, you know that the new cases are the leading indicator. That's not mumbo jumbo. It's what we got to keep our eye on, because it tells us where we will be with the hospitals in a couple weeks, as it takes 2 to 3 weeks between people's diagnosis and their hospitalization if they get really sick. And right now we have 25,000 active cases. Now, recently, about 0.78% of total active cases have ended up headed to ICU. So you can do the math yourself. It's not a model. There's no assumptions. Now, fortunately, we have seen the ratio of people being hospitalized and in intensive care come down a bit. And I think that's the protective effect of the vaccines. But it's clear that in a couple of weeks, we're going to see growth over the next 2 to 3 weeks in the number of people hospitalized. And in the number of people in ICU. And based on current projections, towards the end of this month, we could certainly expect to see somewhere in the range of 200 COVID patients in ICU, in addition to we're carrying a normal patient load of 50 to 60 non-COVID patients. So that would mean, based on the current numbers, where we're headed, it's entirely reasonable to see that we have to expect, anyway, for our planning purposes, and this isn't designed to scare anybody or manufacture anything, this is just what we've got to cancel surgeries and everything else. What we're looking at is 250, 260 Albertans in ICU beds about the end of May, beginning of June. Now, and you know what? As I've said before, Rick, we can manage that with great difficulty. We can manage it thanks to the professionalism of our frontline staff who are working tirelessly. We can manage that because we've stretched our maximum capacity, and we can manage it by beginning to cancel more surgeries. But Rick, here's the bottom line. If it goes much above that, if we start to, I said this to you 10 days or a week ago today, if we start to sort of get north of 300 patients in ICU, we start to head towards the red zone. We are in the red zone there, where we have to do mass cancellations of surgeries because our total maximum stretch capacity for staffed ICU beds is 425. That's for COVID patients, plus another 60 or so for non-COVID patients. So we can't afford to risk that. Now, I do take some solace from what you referred to, that in the last week or 10 days, the numbers appear to have been pretty somewhat stable, but they're starting to move up again. We're over 700 in hospital now, 163 in ICUs. And you know what? Let's pray for a miracle. Let's hope that all of a sudden, all these new cases, these 25,000 active cases, that everybody gets well with that and they don't end up in hospital. But the science tells us different.
And your follow-up, Rick?
Yes, I mean, so given what you've just said, and then I have a real technical question I'll squeeze in there. Given what you've just said, what do you see as the prospects? I know you're having these restrictions on for, I believe, 3 weeks, at least 3 weeks it was determined. what do you see realistically for people who are planning to do things for an opening up, given what you have just said in your previous answer? I mean, could we see people, eating in restaurants at the end of May, or would that be probably a bit unrealistic, that sort of thing? And very quickly also, when you talked about COVID beds, I remember you saying if it gets north of 300, is that 300 COVID patients in ICU beds or just 300 people in ICU beds, COVID and other ones?
Well, I would say
so those are kind of...
Yeah, I would say over 300 people, because I'll remind you, like pre-COVID, our maximum peak of ICU bed utilization in this province was in the range of 170. So if we start getting into like twice our historic maximum, what we're doing then is to care for people is we're shutting down surgeries to move the anesthesiologists and the OR nurses over into increasingly makeshift ICU wards. So we just don't want to go there. And can I say, and I'll come back and answer your second question, but little more context here. I know a lot of Albertans are getting very frustrated watching, tens of thousands of people get together in a football stadium to watch a boxing match in Florida the other night, and people partying it up, and life pretty much back to normal in many of the U.S. states. It kind of makes me ticked off too. There's three things I want to point out. First of all of those states had went into this year with much higher levels of immunity because of higher levels of infection. People got antibodies, which gave them a level of protection. Texas and those states, we estimate at the beginning of March, had about a third of their population had gotten COVID, they had the antibodies, they were protected, versus we might be up at around 12% in Alberta now. But they paid a very dear price for that. With their death rate in states that in the U.S., depending on the state, it ranges between 3 and 5 times higher, or 3 and 6 times higher than Alberta. So I don't think that was a good deal for the Americans, that they got a little bit more population protection at the cost of millions of lives. And hundreds of thousands of lives, I should say, like in Texas, 50,000 lives that have been lost, 3.6 times more per capita than Alberta. Secondly, they got vaccines a lot faster than us. They were about 3 to 4 months ahead of the curve versus Canada on vaccine procurement, and we know the impact that's had. But thirdly, and this is something that we really need to realize as a country, the Americans have way more hospital capacity. Healthcare is big business in the States. They spend 17% of their economy on healthcare. We spend 11% here. And they have redundant capacity because they have a competitive system. We have a single payer system, so we have, by nature, a ration system. What does that mean? That we're dealing on a good day with 200 ICU beds in Alberta for 4.5 million people. And Texas is dealing with 7,000 to 8,000 staffed ICU beds for a population of 29 million. I think that's 3x the number of per capita ICU beds. I'm sorry that was a lot of stuff, but it's important context for people who say, why can't we just be like Texas or Florida or Arizona? Going back to your earlier question, no, I don't think it's realistic that people will be eating in restaurants at the end of May. I do, however, hope that if we end this spike, start to bend down the curve, that we could relax many or most of the measures we put in place 3 weeks ago. Dr. Hinshaw has given you some promising early signals that case growth may be declining, but we can't take that to the bank. But if Albertans really buckle down in the next couple of weeks, and we see that the active cases are going down again, then just as vaccines are starting to really take off and good weather comes back, well, I sure hope at that point that we can pull back some of the measures we had to impose a week ago.
Operator, can you please put through our next caller?
Lauren Boothby, Edmonton Journal.
Hello. This question is for the Premier. I wanted to ask about the AstraZeneca vaccines. So 255,000 doses have been given out. We only have 8,400 left. Canada's getting more AstraZeneca in June, but that's going to be far too long after the first dose for maybe tens of thousands of Albertans. And the science on mixing vaccines isn't set yet. So do you regret not holding on to the second doses to make sure people get the second dose, even as the government knew that supply was starting to become shaky?
Well, okay, first of all, I'll refer to Dr. Hinshaw for technical aspects of that issue, but I will note that the United Kingdom they've led the world, with the exception of Israel, on their vaccination program, and their mainstay vaccine has been the Oxford AstraZeneca that was developed in the United Kingdom. And they went long on the first doses. And I believe, Doctor, there's a study indicating that actually a longer duration in that instance can offer greater protection. So while there have been some challenges and some adverse outcomes related to AstraZeneca, let's look at the real lived experience, where I believe well over 10 million doses have been administered, first doses, in the United Kingdom, with great success. And so I don't regret following the lead of the second most successful country on earth when it comes to the vaccine program. In terms of holding doses back, I'll remind you that our main source of AstraZeneca has been India, and of course they got hit hard by this massive spike starting about 2 to 3 weeks ago, which caused them to put a hold on all export shipments. So we didn't see that coming, but we've been contending with the problem of unreliable supply driven by vaccine nationalism with all three, Moderna, Pfizer, and AstraZeneca. So I think we made the right decision strategically to go long on first doses to get broader population coverage. And I would just point out that we were more cautious than other provinces. I think maybe we will turn out to have made the right prudent judgment to hold back supply for second doses of the most vulnerable. I think the average across the country is 3% having received double doses. It's 8.3% in Alberta. And I think that partly accounts for the extremely low fatality rates amongst our most elderly. And Doctor, would you like to add to that or correct me as you please?
Thanks, Premier. I would just add that the studies that you referenced, the clinical trials that were done pre-licensing of the AstraZeneca vaccine did indeed indicate that with a shorter vaccine interval, they showed less overall protection against infection than with a longer interval. And so the 12 to 16 week interval between first and second doses for the AstraZeneca vaccine was actually the interval that gave the best protection to people who participated in that trial. We know that the earliest date that people will be eligible for a second dose of AstraZeneca from the first date we started giving it will be June 3rd. We anticipate the results of trials in the UK that are looking at mixing AstraZeneca and mRNA vaccines in sequence to be coming out around late May and early June. So between the results of those trials of mixed schedules, between the clear evidence that that lengthened interval is of benefit when it comes to AstraZeneca vaccine, the potential for getting some additional doses in June and holding back the 8,000 doses that we currently have to potentially begin those second doses the first week of June. I think we're very well positioned to have maximal benefit from the AstraZeneca vaccine, and we know that the first dose of AstraZeneca vaccine is equally effective when it comes to preventing infection and severe outcomes, as was seen in UK data from real-world effectiveness studies.
Do you have a brief follow-up, Lauren?
Yes. Are you in talks with the federal government, or, sorry, this is for the Premier, are you in talks with the federal government or other provinces or maybe other countries to get AstraZeneca vaccines so that the people who've already had one dose can get their second dose in time? Because if the supply comes in June, it's going to be far past the recommended time that was initially said to get the second dose for this vaccine.
Well, the answer is yes. We're in constant talks with the federal government, urging them to get more supply of all of these vaccines more quickly. But you know, there are a bunch of vendors. Well, at the end of the day, though, these companies have signed contracts with the Government of Canada to be their purchaser in Canada. So there's either exclusivity in those contracts, or they won't sign contracts with provinces unless and until they've completely fulfilled the orders placed by the Government of Canada. So we're in the back of the line, even if we were to go and try to sign contracts ourselves. So this is something we looked at the very beginning, back in December, January. We looked at if there was any way we could procure doses ourselves, and it's basically impossible for us to do that legally.
Operator, can you please put through our next caller?
James Keller, Globe and Mail.
Hi, this is a question for, I think, both of you, but especially the Premier. Saskatchewan has released a reopening plan that really relies on benchmarks tied to vaccine uptake for their various stages. I know you've talked a bit about that in kind of vague terms before, about what vaccination rates could mean for our reopening. So are you considering actually releasing a plan that sort of sets metrics and benchmarks based on vaccination rates? And if so, what things are you looking for?
Well, yes, we're still in the early days, but our Emergency Management Committee of Cabinet tasked the Department of Health with beginning to develop a reopening plan, part of which would be to track progress in the rate of vaccination of the population. And I specifically asked that we look closely at Saskatchewan's model. It looks quite interesting. So I would say that the Department of Health is at the early stages of developing proposals for consideration by Cabinet. But at this point, you know, our immediate focus is just getting through the next couple of weeks, really through the end of May, to push down this spike. And then I think we can really begin to look forward to coming to reopening many things to have a good summer. Now, this is not going to be completely wide open because for reasons we all understand. But I think, you know, we're looking at probably another 800,000 people that will be vaccinated by the end of this month, the first week of June. At that point, we'll be at 2.8 million Albertans out of, I believe it's 3.8 million who are eligible. So we're getting there, and I think that will be one of the major considerations in the plan for reopening.
Do you have a follow-up, James?
Yeah. So obviously, I mean, whatever that plan looks like, it's even now the goal is to vaccinate as many people as possible. We're seeing, you know, numbers out of the states in particular of places that had strong uptake in the beginning of their vaccine campaign, and that demand has really dried up. And some states have very low numbers and just can't get vaccines out the door. So how concerned are you about the potential for vaccine hesitancy in Alberta to become a problem? And what more can the government do to sort of combat that? And I'd be curious to hear Dr. Hinshaw talk about that issue of vaccine hesitancy as well.
A great question, James. So thank goodness, so far we haven't experienced that problem. There's been an excess of demand over supply, which is, I guess, a good problem to have. And we have seen in our polling that the percentage of people who say they're unlikely to get the vaccine has come down a bit. And inversely, the population, or the percentage who say they are open to vaccination has gone up. So I think we're at about 10% who say, roughly in our own surveys, who say they definitely won't get the vaccine, about 10% who say they might, and about, you know, the balance of the population somewhat or very likely. So we will be launching, as I mentioned in my opening statement, a very big ad campaign. I think has about a $5 million budget. You'll start to see ads posted on social media, on online media, I should say, this week. And then we'll be going to all media platforms, television. We'll be doing a mailer to every single household in Alberta. In fact, I've asked for us to do a second mailer. The first mailer will be giving people practical information about how they can get vaccinated. And the second mailer I've asked for will do an frequently asked questions, essentially to respond to and rebut with hard facts some of the misconceptions that exist about vaccines. We also have a very strong plan to reach out to different communities, you know, through non-official languages to ethnocultural communities. We continue to work very closely with Indigenous communities, for example, to make the vaccines as available as possible. We've encouraged physicians to call their patients, especially if they're elderly patients. One of the things I'm concerned about is that we have 17% of the population over the age of 75 who are especially vulnerable but are not yet vaccinated. And so we believe that for that population, they hopefully trust their physicians. They probably have prescriptions for different drugs. And so we're asking the physicians to reach out to them and encourage them to get vaccinated. And finally, we will be, as Dr. Hinshaw mentioned earlier, we're working with major employers to set up on-the-spot vaccine clinics to make it easier. So we're removing as many barriers as we can, a huge information campaign. But, you know, you're right. At some point, I don't know, in the summer, we're going to see demand slow down. And I think we can be optimistic. I think they're running, you know, you're seeing in some of these states that they're not even reaching 60% of population vaccinated. I think we're going to do that a lot better than that. And Dr. Hinshaw, could you please also respond?
Thanks, Premier. I think you've hit the highlights. Certainly we know that people need different things when it comes to the vaccine. Some people need more information. Some people need a little bit more time. Some people need to hear information from people in their local community. Some people need practical assistance to remove logistical barriers. And so we are looking at all of those things, as the Premier mentioned, working with partners and trying to offer both pragmatic assistance, reduce those logistical barriers, ensure that accurate information is available, and work with partners to make sure that people can hear reliable information from trusted sources to make the best decisions about their health and about the health of those around them.
All right, we have time for 2 more callers. Operator, can you please put through our next caller?
Jeff Slack, 660 News.
Hi there. Thanks for taking my question. Premier, I just want to know what your reaction is to Mr. Madhu's comments on Facebook accusing the Liberals, the NDP, and the media of wanting a COVID-19 disaster, given it was just a week ago you said we shouldn't be politicizing the pandemic.
Yeah, I haven't seen those comments, but I believe no one wants the pandemic. I've said that many times, and we shouldn't be pointing fingers. But I do think that, as I've said before, COVID has caused a lot of us various times to say things that we regret, and I just encourage everybody, whatever side of the political spectrum they're on, to try to give each other a break right now.
And do you have a brief follow-up, Jeff?
Yeah, it appeared that his office kind of defended his remarks and said that he wasn't going to apologize. Now, this kind of outraged many people in the province. The opposition is saying he needs to apologize. The Prime Minister said today that his comments are shameful. Do you think he should apologize for what he said?
Well, I'll take a look at the comments and talk to Casey. He is a passionate defender of his community, and we're all frustrated by where we're at with COVID. But you know, this COVID should not be a political football. It's regrettable that in Alberta, it's been much more that the case where from the very beginning we had an opposition that never sought to be supportive of the broader efforts, unlike in other provinces where oppositions largely came together with government, at least at the beginning of the pandemic. That wasn't the case in Alberta. It's regrettable. But my commitment is that we should all try to work together and assume the best about people's motives.
Operator, can you please put through our last caller?
Audrey Neveu, Radio Canada.
Hi, Premier. Thank you for taking my question. I do want to hear you in French on that topic. Minister Madhu, his comments that he made on the federal Liberals, the media, and the NDP wanting the healthcare system to be overwhelmed. Why do you think he would say something like that? And what do you think? Do you agree with this statement?
Well, I'm sorry. I'll do it in French parce que j'ai déjà répondu à la question en anglais pour dire que je crois que malheureusement en Alberta on a vu les gestes de l'opposition jusqu'au début qui était de diviser les gens en ce qui concerne la pandémie. Je crois que ça c'est malheureux, mais cela étant dit, je crois que même tout le monde a dit les choses qu'il regrette pendant la pandémie. Je crois que tout le monde est fatigué, mais je crois que c'est mieux que nous ne suggérons pas les motifs négatifs. Il faut que tout le monde, excusez-moi, il faut que tout le monde se réunisse maintenant pour la fin de cette pandémie, pour rassembler. Ça, c'est mon idée.
Do you have a brief follow-up, Audrey?
Yes. Monsieur le Premier ministre, est-ce que vous allez parler avec Monsieur Madou ou votre caucus plus largement pour leur dire que ce genre de commentaires, c'est pas acceptable selon vous?
Écoutez, je vais regarder les remarques et parler à Casey. Je sais qu'il est une représentante dédiée et peut-être frustrée avec la division perpétuelle de l'opposition en Alberta en ce qui concerne les politiques de COVID, la tendance au part de l'opposition de promouvoir la division sociale et je crois que ce serait mieux pour tout le monde, de tous les partis, tous les coins du spectre politique, à se réunir maintenant.
That's all our time for today. Thanks, everyone.